Is it possible to estimate how many follicles I'd need to be transplanted to lower my hairline 1 inch using FUE? I am comfortable with my hairline at my temples, and I would like the top part of my hairline to match my temples more closely since right now there's quite a big difference. I measured it and it's about 1 inch. How many follicles would I need to be transplanted and how much would that cost? Also, if I get the procedure, is it inadvisable to wear a fabric headband to cover the transplantation site? I'm assuming the answer will be yes, but I'm unsure. I've heard that hats are okay to wear.
Thank you for your question. You've submitted a question with photos and expressing an interest in lowering your hairline about 1 inch to try to match your temples, and you're asking about how many grafts and how much it would cost, as well as the advisability of wearing a headband versus a hat. Well, when someone like you comes to our practice, there are some other questions that we have to also answer before we move forward with a game plan or a treatment plan. So, first of all, for women, a lot of times a hairline can be high genetically, which I suspect is the case for you, and in other times it can also be getting higher because of a receding of the hairline. Now, why would that happen? Well, for some people, that's part of their genetic hair loss pattern. And for many other people, it's related to the wearing of very tight ponytails. We call this traction alopecia. So you have to now just be sure that your hairline is stable. I think that's the most important thing. Is the question is not about just lowering the hairline, but the stability of the hairline in order to be able to do a very good and accurate treatment, as well as be able to anticipate what's going to happen in the future. So, if your hairline is stable, and if in your family the hairline does not tend to recede, and we've eliminated those other hereditary causes, and we can now fairly predict that the hairline won't change for many years, then we did make the decision about how to strategize the hairline lowering process. Now, there is a couple of options, but in terms of the hair transplant option, you asked about the number of grafts. Well, there's the number of grafts which is limited based on the donor area, otherwise known as the permanent zone. And this is for both men and women, the back of the scalp, where the hair never goes away, whether it's from male or female pattern hair loss. It's genetically resistant. Now, that means hair transplantation is limited by how many hairs can be moved from one area to another. So, if you think about seeing people, particularly men who have had hair transplants in the past, and you look at them, let's say 10 or 15 years later, you'll see the ones where the hairline was made a little too low when they were younger, such that as they got older and the hair thinned, you can see these as being grafts, or as people generally refer to them as plugs. So, understanding that there's a limited supply, then it means that we don't have unlimited hair to be able to transplant. So it has to be done very strategically. Now, lowering a hairline about 1 inch is about 2.5 centimeters. So this is in many ways basically a mathematical equation. When we do a hair transplant, we try to place anywhere from 20 to 40 hairs per square centimeter. So you can imagine that although that density is good and it sounds like a lot, your hair density to really look thick may require 50 to 70 hairs per square centimeter. In other words, when you do a procedure like this, in my practice, what we do is we work from the back forward. And that's opposed to making a line and then working from the front back. When you work that way, unfortunately, you can get plenty of hair into those areas, but they may be so wide apart that they can look very sparse and very artificial. So I always tell my patients is that what we'll do is we will take the maximum amount of hair that we can at this one time from your donor area, and that's whether it's a strip method or FUE method, and then we'll count how many hairs and grafts that we have. And then what we'll do is we'll work from the beginning point of your hairline and build forward. This way there's kind of a feathering effect and it doesn't look as obvious. And if the goal is to move the hairs 1 inch down, well, we might be able to accomplish some significant amount of what you want, but usually for a hairline lowering procedure, you can anticipate a second transplant if you want to get the maximal density that you desire. In our practice, we try to also maximize the yield of the hair transplant through a method of hair regeneration technology we've developed using extracellular matrix and platelet-rich plasma. And the reason for this is that hair transplant practice is not only about how many hairs you move, it's about also how many hairs will actually thrive. You see, it's a graft. It's being taken away from its blood supply, the hair follicular unit, and then being placed into a new place. And we can't assume that if you move 1,500 grafts that you'll get 1,500 grafts growing. And we have seen the full range from people who come to us from all over the world where they could have anywhere from 10% loss to over 90% loss of the hairs that have been grafted. So what we do to help maximize our results is we'll actually not only employ excellent surgical technique and methods and processes, but we'll also use our hair regeneration technology. So even though you're looking for both the numbers of hairs and the prices, I think what you have to do now is actually meet with some qualified, experienced hair restoration specialists and learn about your options and consider the range of what would make you satisfied with the results that you ultimately get. You know, sometimes people feel like they want 1 inch lower hairline, but when you look at a normal natural hairline, the beginning of it can actually appear to be higher than what it actually is when you think of where every hair is. So you might be able to get away with moving down, let's say 3/4 of an inch, and then feathering the hair in a way so that the density flows very naturally. A lot of times you see actors and people who are in the public eye have a very unnatural look because their hairline looks a little too straight. And a natural hairline is variable and feathered and curved, and it just looks, you can't tell a good hair transplant when you see it because it just looks very natural. So again, meet with some specialists and start and do some more research. Learn about the limits of the number of hairs you have, and also when it comes to hair transplant, the factors not only are critical include the hair density in your donor area and the thickness of the hair. If you have very fine hair, you'll be able to cover less scalp than if you have very thick, coarse hair. So these are things that require actual physical examination, and when I examine people, I also do measurements and I do drawings to show how much we can cover so that there's very good communication between ourselves and the patient, and we know what we're going to be doing as long as we are all on the same page. So I wish you the best of luck. I hope that was helpful, and thank you for your question.